In this video, we're going to learn about menopause. Menopause means permanent cessation of menstruation or stoppage of menstruation called amenorrhea for 12 consecutive months without any other pathology. Menopause transition is the period of time during which a woman passes from the reproductive stage to non-reproductive stage, and this phase covers 4 to 7 years on either side of the menopause. Age at which menopause occurs is genetically predetermined and is not related to age of menarche or age of last pregnancy. However, cigarette smoking and severe malnutrition may cause early menopause. Now, let's look at the normal physiology of menopause. Hypothalamus produces gonadotropin-releasing hormone, which stimulates the anterior pituitary to produce gonadotrophins such as FSH and LH, which have a major role in the ovarian cycle. FSH acts on the primary follicles of the ovary and stimulate their development. After passing through various stages, the follicle reaches to final stage to form Graafian follicle. With the help of luteinizing hormone, the Graafian follicle ovulates and ovum is released. The remnant of Graafian follicle forms corpus luteum. Corpus luteum produces estrogen and progesterone. These hormones prepare the endometrium of the uterus for zygote implantation if there had been any fertilization. If the fertilization had not occurred, then the corpus luteum slowly degenerates and hence the level of estrogen and progesterone also fall down. This leads to shedding out of the endometrium called menstruation. Estrogen also provides negative feedback to the hypothalamus, hence the production of FSH and LH are lowered. During the period of menopause, there is no effective folliculogenesis, that is, the follicles are unable to develop, which means there is no ovulation or corpus luteum does not form. Hence, the ovary cannot secrete more estrogen and progesterone hormone, so the endometrium do not proliferate and hence menstruation does not occur. As the level of estrogen falls down, the negative feedback to the hypothalamus is also abolished. Hence, the level of FSH during menopause becomes high. This is also due to the diminished production of inhibin from the ovary. The high level of FSH causes the remaining active follicles to become resistant to it. Hence, the follicles are desensitized to FSH and no folliculogenesis occurs, which leads to amenorrhea. Now let's look at the menopausal symptoms. In majority of women, apart from cessation of menstruation, no more symptoms are evident. In some women, however, symptoms appear. I have discussed the important ones. There is some hair loss and can result into slight balding. Increased frequency of psychological symptoms such as anxiety, headache, insomnia, irritability, depression, and mood swings can occur. The most characteristic symptom of menopause is hot flush. It is characterized by sudden feeling of heat and profuse sweating due to cutaneous vasodilation. This is what causes night sweats. Cardiovascular effects such as ischemic heart disease, coronary artery disease, and stroke can occur. This is due to increase in the level of LDL and decrease in HDL due to absence of estrogen. Now on the genitourinary symptoms. There can be dyspareunia, that is painful sexual intercourse, and dysuria. This is because vaginal mucous membranes have estrogen receptors. Estrogen maintains the epithelium of vagina. Fall in estrogen leads to atrophic changes of epithelium, causing vaginal dryness and hence dyspareunia. Other symptoms such as vaginal infections, pruritus, and leukorrhea are also common. Osteoporosis is also one of the major complications of menopause. It is defined as bone mineral density less than 2 standard deviation from mean value. Fracture of femoral neck, vertebra, and distal forearm or Colles fracture are also common. So these are the menopausal symptoms. Now let's move on to the treatment. Both gabapentin and paroxetine can be given to control hot flush. Similarly, to reduce cardiovascular effects, lifestyle modification and cessation of smoking can help. To reduce bone problems, bisphosphonates and calcitonin can prevent osteoclastic bone resorption. Vitamin D and calcium diet reduce osteoporosis and fracture. Hormonal therapy is the major one and is indicated in menopausal women to overcome the short-term and long-term consequences of estrogen deficiency.